Well, hello, everyone, and thank you for joining our healthcare panel on future-proofing security with data-driven decisions. I'm Chris Lutz. I'm the Vice President of our healthcare vertical here at Convergint, and I'm joined by an excellent group of security professionals that over the next hour or so will provide some valuable insights to the evolution of security within healthcare specifically, and some of the things they are doing with their teams to provide better security as well as really better experiences for employees and patients. To start, we have the Corporate Director of Safety Management and Security from Intermountain Health, Mr. Craig Allen. Craig, thanks for joining us today. Do you want to just take a few moments to introduce yourself and your area of responsibility?
Yeah, I've been here with Intermountain for just going on 16 years now, and we do business in many states. My area of accountability is for Utah, Idaho, and Nevada, where we have clinical care sites. About 25 hospitals. I lost count on how many clinics we have. It's north of several hundred major good sized freestanding clinic locations spread throughout that service area. And I'm accountable for occupational safety, environmental health, security operations, and emergency preparedness. So I have all of those fantastic teams in my portfolio. I probably think that's all I need to share. Yes.
That's great. No, that's
Okay.
Perfect. Thank you, Craig. Appreciate it.
You're welcome.
So again, thanks for joining us today. I also want to introduce Matt Lethbridge, who's the Manager of Security Technology at Atrium Health. Matt, also want to thank you for your time today. And if you could introduce yourself to the audience, that'd be great.
Good afternoon, everyone. As mentioned, Matt Lethbridge. I am the manager for security technology in the Charlotte market for Atrium Health. Within my areas of responsibility is badging, project management, break fix of the physical security systems, all access control, CCTV, all of that. And then a nice kind of change for Atrium is we actually have it embedded application team as well, so that we can manage not only just our hardware, but the applications from, which versions and what new technology we need to deploy. And we have a dotted line over to our IAS department, as well as ties into our clinical partners as well.
Thank you, Matt. Appreciate it. And then lastly, we have Jeanette Evans, Director of Strategic Sales for the Healthcare Vertical with VectorFlow. Jeanette, thank you for being here, and also thank you for moderating the panel discussion today. Could you please introduce yourself to the audience?
Absolutely. Thank you. Thank you very much. I'm Jeanette Evans. I'm Senior Director of Strategic Sales. I have been focused in healthcare for the last 15 years. I've had the fortune to know Matt and Craig over the years as well. Absolutely appreciate what healthcare organizations are doing today and where they're having to adapt and change and evolve year after year, especially after the last 2.5 years of the challenges they've been going through. So thank you, Matt and Craig, for joining us.
Thank you. So before we jump into the panel discussion to understand how our colleagues are looking for unique ways to use data to improve, safety and security decisions, I wanted to take a moment to address how healthcare has really been evolving over the last 2 years coming out of the pandemic. Hospitals, clinics, surgery centers, basically all of those sites affiliated within an integrated delivery network traditionally have been open facilities. But really we found over the last year one of the highest priorities for our customers is locking down locations to restrict the movement of patients, visitors, as well as contractors. Healthcare organizations are moving quickly to electronic visitor management systems to check in every person that comes to a site, and in some cases is even providing card access or wayfinding application capabilities to ensure every visitor arrives to the correct location and that they're known when they arrive in that space. We also know this is helping to meet ongoing capacity planning requirements, as well as determining if visitors are allowed in certain parts of the hospital to, maybe prevent the spread of any potential pathogen. This focus on protecting mobility within facilities is really reshaping the visitor and patient journey rapidly, and it takes technology to enhance the experience. Integration as well to make it work seamlessly, and data to ensure compliance. And reporting and notifications are real-time and accurate with these platforms. Healthcare is also subject to a significant numbers of mergers and acquisitions, right? I think we see that across the entire ecosystem, not just in the hospital market. For the physical security organization, this means a challenge. It means having to manage and navigate multiple disparate access control and video systems, which can complicate the hire to retire life cycle of employees and contractors, especially in a world where healthcare personnel and resources are becoming more and more scarce and are also shared across multiple facilities. So provisioning access control rights and ensuring those that have a badge are authorized to be where they are, when they are, is important. And then also determining who provided that access is becoming increasingly challenging. As organizations rapidly grow and have to navigate different identity databases from HR to IT, all the way down to the access control system. Identity management and visitor management are two topics that are fueling digital transformation in some of our largest healthcare customers. And this is a perfect opportunity, really, I think at this point, Jeanette, to pivot to our panelists to discuss ways that they're meeting these challenges head on. So I'm going to now hand it off to you to start the panel discussion. I also want to let everyone know, not only is this call being recorded, but there is a chat function where you can put questions in throughout the panel discussion, and I'll be monitoring that and make sure we get those questions answered. So Jeanette, I'll hand it off.
Very good. All right, well, thank you. And Craig, I'm going to address this first question to you. We know that organizations are growing and expanding, and when it comes down to it, what does senior leadership really care about? And I know as I was talking to you yesterday, you said that was just one of the many meetings you had on yesterday, is the priorities and what leadership cares about, and what are you looking forward, in the next 5 years, your visions. So Craig.
Yeah, the timing for the question was really good, because we are just in our organization, we're entering the strategy deployment work for 2023 to make sure that the entire organization's aligned and everybody's marching towards the same goals. And then so your question to me was, what does my leadership care about? I mean, we're a healthcare organization, and so we have many many goals, but our values are really focused on quality and safety, and that's both for clinical outcomes, patient safety, but also safety in what we call the environment of care, making sure that the operating environment doesn't cause injury or harm, and it's actually protective. So we're very much a quality and safety driven organization, and and we see our leadership really admonishes us to see everything that we do through that lens, and then also making sure that we're meeting the needs of the populations that we serve. So yeah, and for a security professional, perfect. It's a great environment, because that's what we do.
So it's about reducing workplace violence and making sure your staff is safe and your patients are safe, right? Yeah.
I mean, for me, it's obviously I have safety and environmental health, so there's a little there are larger considerations, but of the top four things that we try to focus on the top four loss sources, and for folks in the safety business, it's usually in healthcare, slips, trips, falls, needle sticks, some type of lifting, material handling related injuries, and the other one's workplace violence. And it's been very interesting. The other three have been going down because we can apply engineering controls to those functions and have some good results. Workplace violence, we are actually, believe it or not, we're actually on a downtrend in our organization because of a lot of the tactics that we've deployed. But overall frequencies has gone up through the pandemic.
Awesome, thank you. Okay, Matt, this one's directed to you, and I know Atrium Health is a very much a visionary organization. They look to the future. They're not looking, behind them. So how do you determine new innovations, new solutions? How do you bring that to your organization? Because sometimes that's a tough tackle because people are just trying to get their job done, get through the door and do what they got to do. But how do you bring those new innovations to Atrium Health?
So for us, one of the biggest changes that we've made is to, I wouldn't say a change, but something we've embraced even more was kind of the voice of the teammate. Going back to workplace violence concerns. It is example, we rolled out a corporate-wide survey of all of our employees to determine, from a safety perspective, did they feel safe or not? And the results of that survey has been almost transformative for how we're approaching a lot of our technology. Things like where we thought perhaps a key in a lock would be a sufficient way of securing a door, and now that becomes the badge reader for accountability and for audit purposes. But from a technology perspective, it's that marriage between us and the clinicians and what the clinicians feel that they need to feel safe, and then you weigh that against, is the technology even feasible? Working with partner organizations like Intermountain Health and other healthcare organizations, as well as other non-healthcare organizations, because they have unique challenges that perhaps we haven't seen. So we take kind of that clinical overriding view or the concerns that are brought by our teammates. We watch very closely to the IHOS and other organizations that are bringing, where there's other professionals bringing their concerns, and then we just try to determine what the path forward is. Financially, as it makes sense to move forward with this, or is there, because we do see a lot of I saw this on TV, and we want to reproduce Hollywood, and sometimes you can, luckily, but a lot of times you can't. So you have to kind of translate technology into reality and then do it from a cost, effective perspective. So there's different tools, whether it's my peers in other industries, whether it is my clinical partners, whether it's paying attention to national events as they occurring, and then ask that hard question. If this happened on our campus, how could we have possibly prevented or reacted differently? So that's a lot of the ways where we try to discover what the new technology is. And of course, our partner vendors are very instrument to that, listening to what is being released and kind of laying that roadmap for our future.
That's awesome. One thing I've realized in working with hospitals share data and information with each other. And especially when workplace violence all of a sudden elevated, started increasing, hospitals really started getting together and saying, what can we do? And that collaboration is huge. And that's, like you said, with other healthcare organizations like Intermountain and across the United States, is understanding what can we do and putting a plan and action in place. So that's perfect. Thank you. All right, so this is going to Craig, and it's about compliance and mandates, the Joint Commission. How are you protecting your hospital in this growing space so that you can be compliant and you can meet those audits and those aspirations of the Joint Commission and so forth?
Yeah, joint. So not sure if everybody in the audience is aware, the Joint Commission came out with new they come out with new standards frequently, but specific to workplace violence, there was a new set of standards that they rolled out effective January of this year, and they're actually these are actually pretty interesting. They require the accredited organizations to do site-specific workplace violence risk assessments, and looking at many different things, but security and access control is a piece of that. Joint Commission's always had elements of performance for security and making sure that you control access to security sensitive areas to authorized persons only. So that's existed for quite some time, but they expanded the scope and reach of that to a certain extent within these new rules. So within healthcare, I mean, OSHA had a best practices guideline for reducing workplace violence in healthcare settings, and that's a fairly dated document. It's over 10 years old, but I think for most organizations, if they were meeting the requirements there, then the pivot to the new Joint Commission rules should not have been that difficult. We've been surveyed seven times now this year under those new standards, and they're definitely looking at it. There's the way what they've put in there for specificity. Any organization that has a good quality improvement or continuous improvement program where they're analyzing, looking at data, and you specifically had this rule requires that you're collecting that data and you're able to look and analyze that, and they expect you to be setting goals around that. So if you're and I'll just put this within the security infrastructure perspective, if you're seeing individuals getting into the facility threatening staff, and this is we have this problem mainly in our clinic settings, not so much in our hospitals where we have a large security presence, but where we do have a lot of not so friendly folks. Just don't know how else to describe them. So what have we done to address that? And so that we're well down the road of doing this, but we've really adopted, because of that, this front of house, back of house standard in our clinic settings, where you can get in and you can be in the reception area, but everything where we do business behind there is completely locked down. So for us, it's been a build out of hard access control in doctors' offices, your family practice clinic, in your neighborhood, where we've never felt the need to do that before, but we've had to harden many of our sites because of those workplace violence assessments.
Yes, some of those recent events probably have really turned the flashlight on about protecting physicians and nursing, like you said, behind that entry wall, right? That first entry point.
And then to Chris's comment about, as you grow and expand, I mean, it seems like we're always adding a clinic here and a clinic there, and the access control that they have is, well, what is that? So
how old is that?
Exactly, or how old is it, and then how do I integrate it into our overall identity management process? And gets to be very technically complex.
Absolutely. Okay, thanks, Greg.
Jeanette, to add to that, I think one of the biggest challenges we also have is the perception, as Chris brought up earlier, that we are supposed to be an open place, feel welcoming, that we don't want patients or visitors to feel that they're, in a lockdown environment, right, which creates very specific challenges, whether, how do you harden a facility where your facility leaders want people to feel welcome to come in, but yet our interest is different. We want to scan every person coming in. We want to make sure we know everyone's going through the door they're supposed to. So I think that's a big part of this challenge is how do we not only how do we work with our leadership to get them to come to a mutual understanding of what is secure and what isn't.
Yeah, no,
so that's a good point. But I'll challenge that a little bit. I once every couple of quarters, I meet with what's called our Patient Family Advisory Council. So they're past patients or family members of past patients. And this is one of the questions I actually put to them, because, there's, now we're in this world where, I'm looking to deploy very invasive screening processes in places where historically we wouldn't do that before, and public perception's changing. I think I think now, yes, we want it to be an open and welcoming environment, but people also want to know that they or their loved ones are going to be safe while they're in there. And it's not lost on the general public that healthcare facilities have higher risk. So when I meet with our stakeholders, our patients and their family members, I'm hearing more and more and more. Yeah, the great artwork is beautiful and the open environment's fabulous, but I want to know that I'm safe when I'm in your facility. So that's also, makes it easier to deploy some of these tactics.
It's a little bit of a juggling act to make sure it's safe and secure, but you don't want it like a prison, but you have to make sure that the safety measures are set in place.
Yeah, nobody wants to walk through like what they do when they're going to catch a flight at the airport.
Yeah, the TSA with the long lines. Absolutely. Okay, Matt, we are in a data-driven world and data management. How do you utilize data to streamline and enhance security? How do you do that? Because there's so much data, and how can you make it intelligent and make the most sense out of it?
So I think part of the biggest challenge has been understanding the data you even have.
Good point.
It's whether it's your CAD systems, your report execs, as an example, where are you storing your data and what story is it going to tell? And I've noticed, and it was a struggle initially we had here within this part, we had just terabytes of data and not understanding what story it told us, whether it's visitor management data, so that you can understand your busier peaks and as opposed to not your reporting data for what you're capturing, whether it's for query purposes or other report requirements. You see a lot of like workplace violence reporting that's occurring in there that perhaps if you're not using your data properly, you're not going to see trends. So trending is an example. Heat mapping, where visitors are coming in, where you're seeing events occurring from, you can relate that. You start relating data points together. Challenges where you start comparing your access control data to your reporting data. So perhaps you have areas that have high incidence of tailgating and you're unaware of it because you're not tracking that data from your access control system. And then you can get even farther once you start understanding your data and your key identifiers, you can start actually modifying your security plans to cover those trends that you see and to help answer the bigger questions for, well, if you have X number of events and you can't report how many events you're dealing with, whether it's workplace violence or other statistics you're capturing, how are you going to justify increasing headcounts for security? How are you going to know where you need to put your officers at a given period of time from a rounding perspective if you're not utilizing your visitor management data, your reporting data? Workplace violence is a great example that Atrium is really focused in on, whether it's verbal workplace violence reporting or physical from the different systems it's captured in. Just because you have 5 different systems doesn't mean you should only look at one. And that was one of the biggest lessons going back 4 to 5 years ago here, is how can we take just this volume of data, tell the security story, reinforce where we need to increase security presence, bring in extra technology that could help scale security up without boots on the ground per se. And then truly understand from like an audit perspective, how are we representing that we are truly managing access control, that the right people are getting to the right place at the right time. So that's like, for us, that's data management within the security realm.
I have a follow-up question on that, Matt. When you have this data and you're able to sort through it, and like you said, trending and information, when you deliver that to your senior leaderships, the folks that are saying, tell me more, are they accepting it or are they questioning it? Because sometimes it's hard to hear, right? You're going, no, that can't be happening.
So I think one of the things that I've also kind of figured out about data is that data tells not just a pretty story, but it can tell a very ugly story.
Yeah.
And at times, whether or not you like it, you have to tell the truthful story. And data is truth. If you present the data, and as long as you don't, try to have it tell the story you want it to, and instead tell what leadership is asking, then I don't face the situation, at least here within Atrium, where my data is questioned because we let the data speak for itself.
That's awesome. That's a good point. I like that. Okay, Craig, this one is for you. It's on, tell me about a current situation that your team took a different approach in regard to increasing a level of security. And you kind of had an interesting scenario here about the canines.
Yeah, yeah, this was one that this was interesting. We'd always had this organic canine program, but it was just at one of our hospitals, and it was really this kind of niche thing because the manager there was a retired canine handler with one of the local jurisdictions, and well, I just can't remember how we ended up seizing on this idea, but we've gone from one dog to 16, and we've got one of the largest canine programs in the West, and our canine officers are winning awards at competitions, beating out we're beating out FBI canine handlers, some of our local law enforcement agencies as well in different areas. So, but yeah, we are not an armed proprietary force. So our armed response capability is really limited to where we have police officers that are working for us, which again is few and far between. And anybody out there who knows what's the issues we're experiencing with recruitment for our law enforcement agencies. I mean, even if we had the positions, we couldn't fill them. So we were looking for something else, and the canines just fit the bill, and we really target those in locations where we have higher incidents of workplace violence. And believe it or not, we have several locations that that have inpatient behavioral health, so where we're getting people for behavioral health screening. And just a dog, it doesn't matter what your state of mind is. Nobody wants to mess with a dog. I mean, people don't care about if they're going to get hit with a taser. It's fine, whatever. They get up and keep fighting. But you show a dog with teeth and they get compliant very, very, very quickly. We've never had to our procedure doesn't allow us to do this, but we've never had a dog actually attack or hold anybody. Just a bark is usually all it takes. But we ended up deploying canines at a couple of locations 24/7, and have just really driven our workplace violence incidents down significantly. And if we could operationalize this at more locations, we would certainly do it. We have the support of leadership. It's tough to find officers that want a dog living with them and their family and are willing to make that extra sacrifice, because the dog and the handler are paired.
That's pretty cool. You said you had 15 canines?
16. Yeah, 16 now, and we're looking, there's 4 more we're going to try to add this year.
Awesome. That's cool. Matt, I don't think I've ever heard you talk about a canine force at Atrium.
No, we do have armed, unarmed. We do have corporate police as well, but we do not have a canine program.
Okay. And Craig, do they detect drugs and weapons as well?
Yes, they're not weapons. No weapons. No, they're trained for drugs, bombs. I'm sorry, not drugs, bombs and apprehension.
Okay.
We've got more drugs. We got drugs all over the place. We don't train the dogs to detect drugs. It's
I guess that would be a challenging one.
Yeah. Drive the poor dog nuts. No, it's explosives and apprehension and control.
Very cool.
It's interesting. Actually, one of the comments that came in, or it wasn't even a question, it was just reinforcement of what you started with, Craig and Matt, is that one of the attendees from Providence, Alaska, says they've deployed canines as well with a lot of success. So maybe this will start a trend post this call, but or maybe it's already out there.
That's good. Matt, with the the challenges and the issues and the pressures you have today, what is your team doing to help increase and make these conditions aware at your hospital? Meaning, how are you dealing with all this from a security perspective, IT, HR, across the board? How does that look?
So for us, it became a lot more collaboration was the only way we were going to get through kind of what this current crisis has been. And I guess what you'd almost foresee is what the future of healthcare is going to be. Between its collaboration of our technology team residing within corporate security in conjunction with our operational leaders, clinical leaders, and then you get into the larger executive leadership, and it's having a voice at various committees like workplace violence committees, identity governance committees, trying to marry technology to help scale security presence. Whether that is from a forensic perspective, we are a lot more engaged in the forensic side of things because there's your CCTV systems, and then coordinating that to access control, to visitor management. Part of visitor management that our team's responsible for is also responses that, have you left the country, or are you having these diseases or these symptoms of a potential disease? And then trying to tie that back into like a patient's epic record so that it helps infection prevention if you ever have to get to a patient zero, as an example. So a lot of the mitigation has been breaking down the silos and opening up the communication between ourselves, and whether it's information services, whether it is our nursing leadership or our clinicians at the practice levels, and just developing a lot closer ties. So while we're not operational within my department per se, we have a lot of ownership into the operations world and a voice to come to the table with recommendations if you can't put an officer at every door. So how do you increase your barrier protection? What kind of being a part of the security reviews and assessments, in particular ambulatory and clinical world, or MOBs, where you might not have that officer there, where from a cost perspective it may not make sense or may not be available at that time, but how can you have your staff have security options to feel safe, whether it's through panic buttons, through integration, so your systems are actually communicating to each other. You can have overhead paging tightened up. How do you do mass notification as a prime example? More of a newer technology, not necessarily, but being integrated to more things than ever before. So for us, it's really come down to the partnerships within the clinical and the support worlds, whether it's facilities management, making sure that even the barriers themselves are repaired properly, are working properly. We have a lot of instances where out of sight, out of mind, someone knows that door just doesn't close all the way and it's not reported. So how do we streamline even just the repair process, physical barriers to protect our staff?
I think that's pretty amazing. And Craig, you would probably say the same thing, as breaking down those walls across all your different organizations. Everybody has a seat at the table, and the way you collaborate and work together really makes your organization so much more efficient, even though you have your lists of challenges and issues. But when you bring in nursing and patient services and IT and security, and you're all sharing that information, I think that is a huge step and maybe a differentiator between yourselves, you and Craig, and other organizations that they can learn from that. Craig, I'm sure you do that as well.
I as I was listening to Matt go through all of those different areas, there was, and Matt, you hit the nail on the head. But the other thing that hit us this year, that was a first for me. So now I've got to make sure that people coming in, that are doing business with us as contractors and suppliers are vaccinated. So trying to integrate, and this, I mean, now this is a big deal, because if you don't get that right, this is CMS conditions of participation, and in theory that you could lose some serious coin if you're not executing on this. So getting capturing vaccination status from our third party supplier credentialing folks, and then integrating that with our security applications, so none of our sites can generate a badge for a supplier without that vaccination. And it's not an attestation anymore, it's an actual show me the record. That was something that was really, really tough to operationalize this year.
Yeah, and I would agree. And it's also having to work with departments perhaps you didn't work as closely with before, whether it's like materials management, OGC and legal and risk and compliance, where you do have normal connections to them, but having to get into that badging realm with them and understanding who's should and shouldn't get a badge and vaccination. And I'd be the first to admit, we are not the gatekeepers for someone's vaccination status. And it was definitely a learning curve where if we didn't have the relationships with those other partners, I'm not sure, I don't know how successful we could have been.
Yeah, I mean, this was like, okay, yeah, I agree with you. I mean, no, we don't do vaccinations. Somebody else can go figure that out. All I need to know from you is, from our partners, is you tell me whether your supplier is vaccinated or not. And I need to be able to capture it. I need it in writing, and in case in case we ever get audited. And boy, was that, and then to your point, so now we also have folks that we had never collaborated with in the past because, they never had concerns about getting people in. And now they're saying, well, okay, why aren't you giving my so-and-so a badge? And we had to work through a lot of those denials this year.
But I will, Greg, I will say at the end of the day, though, it reinforced to us the importance of actual identity management. Whether it's the visitor, the employee, showed big gaps in the contractor world that we have been, I haven't talked to a healthcare system yet that says that that's not an issue. I mean, we're tracking 200,000 plus identities here at Atrium, that, these are badged identities, and that vendor piece is the least control of all of them. So I will say this collaboration also opened the eyes of our new partners and the groups we work with, so that they can understand that, if I need an electrician, I can't just say, give that guy a badge. There's steps that need to be taken for ownership, sponsorship, and, just overall compliance.
Yeah, I mean, we auto expired all of these folks. We had drop dead dates. We auto expired them in our identity management application, and then the phones were ringing off the hook.
Yeah, absolutely. So this question is actually to both of you, because you both are in that growth mode, acquisition and so forth. Doesn't that bring in new challenges and issues when you start taking on new healthcare organizations, whether it's in the joining within the state or across, the United States? So Matt, I'm going to let you start with that, because congratulations on Atrium and their track record in growing over the years. What's your strategy and tactic and making sure that security is kept tight, and as you expand and grow across the multiple hospitals?
So I wouldn't say they're challenges to us, they're opportunities. We look at, as we bring in new partnerships, whether it's with Wake Forest or Navicent Health or Floyd Healthcare in Georgia, we all have our different flavor in how we do things. And I think the opportunity has been that it's given us exposure to new eyes to what we do, to be able to see what they do, make comparisons, and determine what is best for the organization. None of us do it 100% perfect, but for us, they're the opportunities to learn from each other, adopt new technologies. It isn't always just, the Atrium Charlotte way. Wake has some amazing initiatives that they've done, as well as Floyd and Navicent. So The challenge, or I will say in that, is identifying those differences clearly. Whether it's, if you're talking your security dispatch apparatus, each dispatch center is monitoring different alarms that is owned by a different department in a different market. So that's be the challenge. And to me, it really comes down to, how do you identify what each market is doing, and then start the honest and open discussion about what is best for the organization? How can we effectively either mirror processes or change processes to better reflect an enterprise strategy, and not have the mindset of protectionism, or, one person does it better than somebody else. I think that is the challenge. And then once everyone buys in, you can start doing your technology comparisons, your process and policy comparisons, and come up to a vision from that enterprise view of what, at least in my realm, security technology could and should and would look like, as long as you have all that buy-in. And really, it does come down to your executive leadership helping shepherd those relationships together, which thankfully here at Atrium, I feel very blessed that we have that.
That's awesome. Yeah, it's really a growing relationship. Like you said, best practices and lessons learned. And when you're collaborating and exchanging information like that, you just become better. But if you go into it with it's our way or the only way, that's probably not a winning ticket. So being able to talk to those other organizations and find out what works better.
And I would say the last piece of it is also kind of learning, you don't know what you don't know. And when you start looking in particular, whether it's a security dispatch operation, and do you need a PSIM? We do not have one here at Atrium Health in Charlotte. Do you need a full-blown identity governance product that's from vendors to staff, or students? So as you're expanding, identifying the proper tools to help reduce the cost and be able to scale that management without having to rip and replace, that to me, I will say, is the challenge in identifying the right product to accomplish that kind of integration.
Yeah, and with rip and replace, that comes funding and budgets, and that's a lot of it. Yes. Craig, how would you respond to the growth? Because you've expanded recently as well, correct?
Yeah, we're in the middle of a merger right now with SCL Health, and this has not been painful for us. We've been on this growth trajectory now for several years in many different markets. And this gets back to the question that you asked me when we opened this, and it had to do with senior leadership. And I count my blessings because our leadership, as they've executed on this growth strategy, we're growing with like-minded and like resourced companies. So it's not like I'm going, we're picking up 20 hospitals that have securities and who word to them. We're merging with security organizations that are equal to us in capability. So really this has been an exercise of just looking at, hey, how do you do this? And we're doing it the same way. And I found that to be very, 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 very consistent. Different systems, different technology choices over the years. I don't think rip and replace. I just lived through, we did a rip and replace, but that was necessitated because, and it wasn't because of an acquisition. It was because we had some stuff that was dated and it just needed to go. Yeah. And so, but now I think the path is really just on a go forward basis. We have a standard, and there's a lot of latitude in that, and we leverage the identity management application overlay to help make that happen, recognizing as this goes forward, we're always going to encounter organizations that have made different technology choices because it worked for them. So the challenge is is integrating that without being disruptive. And I said we've been very successful so far in making that happen, because the merger path has been with peers. It's really been, we see them as peers, I think, not like, they're acquisitions.
Right.
So it's been very fluid, but rewarding, I think. Just getting the ability, being able to work with new folks, and it's been interesting. Oh, you're using the same integrator we do. That's great. So we've made
Does help, doesn't it?
yeah, it makes makes life really easy.
Yeah. So in closing here for both of you, and thinking of future and security and where you're at today, what's your roadmap look like? Matt, what's that magic roadmap, that little secret, that golden nugget that is really powerful in the next coming years?
I think for us, it's becoming, how do we utilize technology to be more proactive instead of forensic?
Okay.
And whether it's coming from the RTLS world, where you're seeing a lot more utilization of BLE devices, where you might have more control of it, or it's coming from just something as simple as duress solutions. It's not simple, it's actually incredibly complex. And our roadmap is really, how do we provide a safety solution that is a standard that we can apply across our market regardless of size, and develop the integration so we can make technology more, we can leverage technology more to reduce resource costs of having to have a person at every door. Mass weapon detection systems as an opportunity, getting a closer look at the future state algorithms that you start talking about, whether it's facial recognition. Not saying that's the direction we're going, but how do we utilize technology as it's growing to be able to scale more and make us safer, and also be able to start becoming predictive instead of reactive? That's really what our roadmap is, especially awesome. During these merger times. It is very much also aligning our organizations to have that standard and that strategy.
Right. Craig, what's some of those visions you have? But that is that. I love when Matt said, you don't know what you don't know, but what's your vision look like?
It's, I could just regurgitate everything Matt just said. We are very much challenging ourselves to leverage technology to be more predictive and less reactive. We've already made some choices. We're moving down the RTLS path for staff duress. We've had mass notification deployed for years, and I think we're fairly solid there. But you don't know what you don't know, and I can't have security. I can't have security in all places at all times, and I can, we're in a 7,000 or 8,000 camera system right now, just on our side of the organization, not even counting what our merger partners have. And you're not looking at that all the time. So we're trying to leverage video analytics.
That's a good one.
And we're standing up for the first time a security operations center, which is, it's new for us. I mean, we were just this small system in little Utah when I came to be here, and now we're getting to be quite large. Yes. And the external threat environment's very much changed. So it's again, technology so we can be predictive, not reactive, and anything we can get to give us more situational awareness of what's happening in the local environment.
Very good. Well, gentlemen, thank you so much for joining me today. It's always a pleasure in speaking both of you. And with Intermountain and Atrium Health, you've always come to the table with visions and future. And like you said, being proactive and really looking at what are the solutions, what are the innovations we should be looking at. Maybe it's a good fit or maybe it's not a good fit. But I hope the audience today learned a few things, and I'm sure they did. Chris, I'm going to turn it back over to you. I don't know if there's any other questions, even questions that you might have for Matt or Craig, or that came from the audience.
No, I actually, this is a great discussion today, because I think it talked about, obviously, the importance of physical identity access management and visitor management. We talked about a whole range of from workplace violence to how we're managing that, how we're managing some of the M&A activity and some of the disparate systems we have within our facilities today. So that was a really good discussion to cover a wide range of topics. And I think really, to be honest, what Craig and Matt, you're facing every day, right? And I think your colleagues are facing every day, right? Your job's not getting easier. I think it's getting harder every day, right? And so it was just good to kind of hear what you're thinking about too, just in terms of your technology roadmap going out into the future. And I guess I do have kind of one question for you, since we have a little bit more time, unless Jeanette, you had another one you wanted to ask.
But all good.
Obviously there is this, we're seeing this across multiple verticals, right? This kind of move from on-prem to the cloud. How do you see that impacting some of the physical and electronic security solutions that you're deploying today? And what is your cloud strategy from a security perspective, or as a facility, how are you looking at it?
I'm going to let Matt, this is going to be more in Matt's wheelhouse than mine, because any of our applications run through our IT organization, and it doesn't matter. I mean, I'm in it, I'm one of their stakeholders. They support us, but they have their standards, and anything that I want to do has to fit within that standard. And I'll tell you what's changed. So I would say 4 or 5 years ago, the minute somebody walked in the door with a cloud solution, cloud was a 4-letter word to everybody. And my IT security people would, that was DOA. That's changing a little bit. I think some of those solutions have matured, and the on-prem environment brings its own problems. So there's, at least within our organization, it's not DOA anymore. They'll at least look at it, and so there is that shift.
Good. Thank you.
So I would say for us, actually, cloud-based has become more prevalent than it's ever been. When we bring new applications to the table in conjunction or with IAS, and say we like to consider this, the first question out of their mouth is, can it be hosted on Amazon or Azure?
Yeah.
So they're very much pushing us towards the cloud-based environment, but we're given the leeway to be able to explain why it can't be. For example, latency issues in RTLS, if someone's hitting a duress button, you can't have that long delay, because you're expecting accurate location of where that person is, or if it came from your info protection system, where that alarm came from. You don't have the delays. And latency is becoming such a hot button subject that, for us, it's creating a new challenge, because here in Charlotte, we've since moved our data center out from the Charlotte market to another state, and that's creating latency, complexity, with the DR even farther away than that. So what do you do when your vendor tells you you can't have more than 200 milliseconds latency, otherwise the product's not going to work, or we're not going to support it, or anything else? And then when your IS department is telling you, we refuse to allow you to stand up a server right in the building that you need the low latency. So it is creating challenges, not just for us, but to our vendors. And I will say, I'm finding the vendors are getting more adaptive, where before they were like, oh, well, we just won't support it, to now they're rewriting their applications themselves, and they're re-engineering their products to accommodate healthcare, instead of us being stuck in an application box.
Right. Yeah, it's different. You mentioned staff duress, and I know Craig, you mentioned it as well. And just curious, where do you think your responsibilities kind of end as kind of heads of security from a staff duress perspective? So, and let me be real specific here. So, a lot of times we're looking at staff duress, we're looking at deploying those staff duress solutions, say in the acute care setting or in the brick and mortar setting. But obviously now with the move to home care, right, and a lot of our staff members having to go into homes, there is some security risk associated with that. So where is that part of your overall strategy, kind of that continuation into the home? I guess why or why not, right? Just trying to understand how you're thinking about it.
Yeah, no, it is for us, because I'm accountable for workplace violence strategies in our organization. So this is something that we're very acutely aware of, and we're trying to look at solutions that'll give our home care nurses in particular that ability to summon help if they need it.
Right. Thanks.
And I would say the same thing. We've taken duress and we look at it from three different buckets. You have the acute duress where you have staff on site, and then you have your ambulatory duress, and then finally you have your health at home duress kind of solutions. And we have been very much, we're doing technology discovery across all three. Ambulatory, the challenge is if you have a panic button, where is it going to go? Do you give them a wireless panic button at a higher cost, or so there's a lot of discovery that I think every healthcare system is doing right now. I talk with a lot of counterparts, in particular the home healthcare workers, because we're leaning more on it ever since COVID. That whole telepresence that's out there is resulting in more visits to homes than it ever has before. So yeah, we have as much a mandate to keep them safe in my mind as the doctor who's standing next to a security officer.
Absolutely. Yes.
Yep. So just looking down here. So I think, we had some reinforcement come in, but I think you answered all the questions throughout the course of the dialogue and the panel. So just Jeanette, thanks for moderating the panel, of course. And, I want to say thanks to both Matt and Craig on the screens and for your time. I think your knowledge. I think it's always good to share this. Just it's really good for, I think, even for us to hear kind of how you're thinking about things, right? It just makes us a better partner, as we continue on and, supporting our customers across. And I think all the attendees, probably got a lot out of it too. And at the very least, probably reinforce some of their thinking too, as they're listening to you. And I think we're all in this together. And I think healthcare is one of those environments, and kind of what I heard from you a little bit too, Matt, it's unique. Right. And there has to be, we have to make sure that the technology and how that technology is integrated is that we're adapting to the healthcare environment. Right. So it's really important. So just thanks for your time today. Appreciate it. Appreciate all the attendees for joining the call today. Have a great rest of the day, great rest of the week. Thank you.
Thank you very much.
All right.
Bye-bye.
Have a good week. See ya.